So, good day everyone. I'm Vidalis Nicole Gafood from Isabela State University Main Campus. And for today's video, I'm going to do the assessment of the mouth, throat, nose, and the sinuses. So, prior to the conduct of the procedure, first we must ensure to perform medical hand washing, and also we need to wear gloves. After that, we need to gather the equipments needed. So, good day, ma'am. I'm Vidalis Nicole Gafood from Isabela State University. For verification, ma'am, what's your name?
I'm Lorna Biga Food,
And your age po?
47 years old.
So, ma'am, I'm here in front of you to perform an assessment in your mouth, throat, nose, and sinuses. And for me to do that, I'll be able to touch a certain part of your body if it is okay with you, ma'am.
Yes.
So, rest assured, ma'am, that all of the findings are strictly confidential. So, we perform this to ensure that everything is in normal. So, if there are any abnormalities, we want to take note on that to prevent any other complications. So, what language are you comfortable with po?
Tagalog or English?
Okay. So, I have few questions for you, ma'am. Do you have any problems with your nose like frequent cold sinus po?
So far, as of now, none.
Okay. When do you last visit the dentist po?
2 years ago,
Okay. Do you have any problems with your teeth and your mouth po?
none, ma'am.
Okay. That's all. Do you have any question, ma'am, before we proceed to the assessment?
No more.
Okay. If you have, feel free to ask me throughout the procedure po.
Okay.
So, let us now proceed to the first part of the assessment. Okay. So, now I'm going to inspect for the nose. So, I assess that it is in the midline. Also, it is symmetrical. Also, we try to inspect the septum, and it is also in the middle. So, also we try to inspect the nares. So, as I see, it is in the same size. So, that's good. Then, after that, we're going to palpate the nose to see if there any pain or tenderness. So, ma'am, I'm going to check your sinuses. Tell me if you feel any pain po, okay? Do you feel any pain, ma'am?
No.
Okay, that's good. Then after that, we're going to determine the patency of both nasal cavities. So, I'm gonna ask you, ma'am, to close your mouth and exert pressure on one naris like this. And then, breathe through the opposite naris po. Okay? Do you have any problem with that, ma'am?
None, ma'am.
In the other side naman po? May problema po doon?
Wala po.
Okay, that's good. After that, I'm going to assess the ear moves. I'm going to assess the mouth. So, here we try to inspect the outer lips for the symmetry, also the color and the texture. So, as I assess, it is moist. It is soft, and it is pinkish, and I don't see any abnormalities. Then after that, I'm going to palpate the inner lips and buccal mucosa for the color, for the moisture, also the texture, or if there are any presence of skin lesions. So, ma'am, I'm gonna ask you to relax your mouth. Okay. Okay. So, as I assess that it is moist, is smooth, and soft, and also it is elastic texture. That's good. Then, after that, we're going to inspect the teeth and gums while examining the inner lips and buccal mucosa. So, ma'am, Can I ask you again to open your mouth now? Okay. Can you show me your teeth now? Okay, so as I assess that your gums is pinkish and it is moist, firm, texture, and I don't see any retraction of gums. So that's good. After that, we're going to inspect the denture. So ma'am, can you show me your teeth again? Okay, so as I assess, it is intact dentures. So after that, I'm going now to proceed with the inspection of the surface of the tongue for the position, for the color, and the texture. So, ma'am, pakilabas po ang dila. Okay. So, as I assess, it is in the central position. Also, it is pinkish color, and I don't see any abnormalities. Then, after that, I'm going to inspect the tongue movement. So, ma'am, pakitaas po yung dila. Taas po. Okay? Sa kabila, sa side po. Sa kabila naman po. Okay? So, as I assess that the tongue moves freely, so that's good. So, now we're going to proceed to the inspection of the base of the tongue, the mouth floor, and the frenulum. So, ma'am, can you place your tip of your tongue against the roof of your mouth? Okay. So, as I assess that it is smooth tongue and with prominent veins. So, next, we try to inspect the hard and soft palate for the color, shape, and texture, and if there are any presence of prominences. So, ma'am, can you open your mouth widely po? Can you tilt your head backward po, ma'am? Tilt your head backward. Ganon niyo po. Okay. Okay. So, as I assess that it is, the color is normal and it is smooth. Then after that, we need to inspect the uvula to see the position and mobility while examining the palate. So, ma'am, can you say a po? Can you say a? Again, yung relax niyo lang po yung tongue niyo. Can you say a po? Okay. So, as I assess that it is positioned in midline and it is soft palate and it rises during the vocabulation. So, that's good. Then after that, we're going to inspect for the oropharynx and tonsils for the color and the texture. So, ma'am, can you open your mouth again? Okay. So, as I assess that it is pinkish and smooth. Then after that, I'm going now to remove my gloves and perform hand hygiene again. So, ma'am, I'm done assessing your nose, mouth, and your sinuses and your throat. So, if you have any concerns about your health, feel free to, I'm going to refer you to a physician po. And thank you po for your cooperation.
You're welcome.
God bless po.
Thank you.